More than 10 machines of the light shear for the hair removal. Had published many papers and textbooks on hair removal. So he is really the artist and authority of hair removal market in Korea. Let's welcome Dr. Ko Woo-seo.
Thank you very much for inviting me this APEC Lebanese user forum today. I just briefly talk about my 18-year experience of light shear hair removal in Korea. Because we have only 20 minutes, so maybe I cannot tell or I touch every detail of what we have to do. But I try to give some brief impression what we have to do for getting best results. What I talk today is about key points of understanding light shear and about my clinical experience with light shear, and briefly I tell about how to make a perpetual permanent hair removal results. And I will skip today about hair structural basic, laser basics or laser hair removal mechanism or detailed specification of light shear. In the market, we can see wide variety of subtypes of light shear, and actually I started year 1998. For the first time I started to use light shear, so I have experience of almost all subtypes of light shears, but we don't have to differentiate subtypes if we know the spot size issue. Actually, light shear is the first FDA approved laser systems for permanent hair reduction. If we look at spot size, we can differentiate everything. At the beginning, 9x9mm spot size was introduced in year 1996. And after that, the company increased the spot size and surrounding cooling plates became symmetrical. And after a long time, Duet is introduced. Duet have two different spot sizes. One is 9x9mm and the other one is pretty large, 22x35mm square. And also vacuum. And recently, Desire is introduced into the market. What's the difference between Duet and Desire? Desire have bigger spot size. 9x9 became to 12x12mm, and the other HS handpiece is the same. So why I like 12x12mm spot size a lot. 9x9 is okay comparing to all the general laser systems for hair removal. But if you compare 9x9 and 12x12, 12x12 have pretty big spot size. Even it looks the same. If you look at lower left rectangular shape comparison of spot size, it looks quite similar. But if you calculate this area, 12x12 have 1.7 bigger spot size, and which the 1.7 times it means huge difference. And also recently in the market you can see Infinity, light shear Infinity. Infinity is composed of two different wavelengths, 1060 nanometer diode laser system and also 805 nanometer diode laser system. And each wavelength has three different spot size. One is HS handpiece, large handpiece, and the other two is 9x27mm and 9x9mm. But I don't have any experience of using Infinity, so today I talk mainly about my experience of using mainly 12x12mm spot size. So far, I first encountered light shear in Wellman Laboratory in Boston, Harvard Medical School, the prototype of light shear, and year 2000 I bought the first light shear in Korea. And from year 2001 to year 2008, I bought 7 more 12x12mm spot size light shears. And year 2010, I bought 2 Duets. And last year, I used Desire for a month. And after that, I ordered, but still I'm waiting because there is a problem of approval by KFDA right now, but I'm waiting desperately the desired system. And also, I purchased 4 other diode laser systems from other company made, but I still mainly use light shears in my clinic. And this is very interesting part. This is about which area is most popular area in my clinic. When I opened my clinic for the first time, year 2000, female underarm was the #1. And after 2 or 3 years later, female extremities became the #1 area. And year 2005, in South Korea, the costs was going down dramatically. So these days, in South Korea, some clinic charge only $10 for 5 treatments of underarm. That's the reality. So I moved to a little bit different area. So I started to widening narrow forehead using laser hair removal. So hairline correction was the #1 year 2005. But gradually, female patients asked us that they want to remove hairs on bikini line, or they want to remove all the hairs of pubic hairs, Brazilian hair removal. And it became #1 treatment area about year 2010. But it was good for my clinic, but more and more clinics are start to advertise bikini area also. They followed me, so I moved to a little bit more difficult area to male face hair removal. So these days I treat mainly male face hair removal. And interestingly, male patients want to remove pubic hairs also. So male bikini line or male Brazilian hair removal, the number is increasing these days. So if I look at the trend, then maybe 2 years later or 3 years later, the #1 area might be male Brazilian. I don't know, but let's see. The main reason of change is, as you know, the dramatic down of treatment costs in South Korean laser hair removal market. I show you what happened if we tried our best, and I'll briefly touch the parameters. First, underarm. Before and after. I treated 5 times. It's very regular, just average results. You can see some hairs left, but more than 90% of hairs are gone. And the important thing is to look at the results at least 6 months after final treatment. That is very important. If you look at 2 or 3 months after treatment, most treatment, laser hair removal treatment results is very good. Results are very good. But if you wait for more than 6 months, you can finally get to the permanent results. So the right part shows 2 years, 9 months after final treatment, 5 treatments. And also, this patient is very lucky because almost all hairs are gone forever. 3 years, 7 months later, 5 treatments. And extremity, I treated only 3 times. And the after picture shows 3 years later after final treatment. And also 3 years, 2 months after 5 treatments using light shear at which have 12 by 12 millimeters per size. And 5 degrees Celsius contact cooling is very important also. I will talk about that a little bit later. Narrow forehead. Year 2000 from year 2000 to year 2010, I maintained my clinic doing this because all the other hair removal clinic, they invaded into the market with advertisement and they reduced the cost and I have to be survived. So I moved to a little bit different path to be survived in the market. So I made this kind of treatments, and this is permanent results definitely because 3 years and 11 months have passed after 6 treatments. But if you look at the parameters, I am using 2 different wavelengths, 800 nanometer, and also I'm using long pulse neodymium YAG laser. The reason that I'm using 2 different wavelengths and 2 different laser systems is to make irregular response. Because if you make regular results, a very continuous, good results, then you will make artificial hairline. So you have to try make irregular response. Before and after, and before and after. And just example, before and after. Even though it looks a little bit dirty, but you have to stop at this point, because if you remove all the hairs on the forehead and eyebrow, above the eyebrow, then friends of this patient will comment that your forehead hairline looks artificial. So the key point is stop before completely removing the hairs on the forehead, like this. We can change male type forehead to female type forehead using hair removal system. And the image or impression of the people is quite different if you have a smaller, narrow forehead, and if you widen a little bit of forehead, it looks completely different. The facial impression image is different. Like this. This guy told me that no woman tried to talk with him before widening forehead. And after widening forehead, he married. So that's huge difference. And I moved to male face because a lot of other Korean clinic tried to mimic my policy. So some other clinics started to treat narrow forehead also, and also bikini line. I'm sorry, I don't have enough pictures to show in bikini line because I do not take pictures on bikini line or pubic area, so I'm sorry. But anyway, bikini line or Brazilian hair removal was #1 area about 5 years ago. And after that, recently, I focused on male face because it is a little bit difficult to make good results. Before and after, 7 months after 6 treatments, and the exact parameters are shown in this. The key point of doing this is slow treatment. If you treat quickly, you cannot get these results. So very, very slow treatment is required for getting this treatment. So even though the area is very small, it takes more than 20 minutes or 30 minutes to finish one treatment. Before and after. And also, the image is different and looks much younger after removing facial hairs. Please do not ask me why these patients want to remove facial hairs. I never asked about that. I just followed what they want. I never asked the reason. So please don't ask me about that. Just ask me how to get this result. Before and after. So if we look at the serial change, after one treatment, you can see really nice results already. But if you stop treatment and wait, then you cannot remove whole hairs permanently. You have to attack hairs continuously, even though you cannot see any hairs. That's my experience. So keep going on at least 6 times. Even though you see the good results, then you can get permanent results. So if you look at the first treatment results is very, very nice. but I treated again, and patients complained pain a lot. That means there are lots of hairs below the skin. You can realize, if you treat, you can realize that, oh, a lot of hairs are growing out below the skin because patients complained pain a lot. And after 2 treatments, interestingly, the picture shows a little bit regrowth of hairs. That is because of hair cycle. So it's better to tell the patients that your hairs will grow out after 2 treatments, because I treat every 4 weeks or 6 weeks, and 3 months means regeneration of collagen hair. So after 2 treatments, the cycle is quite similar to regeneration of hair cycle. So usually I can see the regeneration of hairs after 2 treatments. That's just a very minor point. And right lower part is the final result taken at least 6 months after final treatments. So that is permanent results also. These patients visited me after receiving 6 treatments in other clinic. The left picture shows results after 6 treatments in other clinic. And I treated 7 treatments, 7 times, and the result is right picture. If you look at carefully, there are a little bit more hairs are left comparing to previous patients. I continuously experience that if some clinic have treated poorly, then hairs became resistant. So we cannot get enough complete permanent hair removal in this kind of patients. I can make quite reasonable results, but I cannot make complete permanent results if the patients already received a very poor treatments, 5 to 6 treatments. So it's very, should be very careful. From now on, I'll talk about how to maximize permanent results. These are 10 points that I summarized. So wavelength is important, perspiration is also important, and fluence, definitely, if we use higher fluence, we can get better results. And spot size issue is very important also. And epidermal pruning is another important factors. And coverage rate. If you skip some area, then the skipped area usually will be resistant. So coverage rate is also very important for getting permanent results. And follow-up interval is important, and proper care of side effects is necessary. And I hired 35 physicians so far for 16 years, and I realized that character of a physician is very important. If the physician is not cannot be accustomed to tedious job, it's better not to start. It's really, really tedious job, hair removal is. So if the character of a physician is in a hurry, then they skipped a lot. So after I realized that, I tried to understand the character of physician when I hire a physician. And we talked much, and then we try to find the proper physician. And proper evaluation of a permanent result is also important. I'll talk briefly about the half of the point. Proper wavelengths. So far, 755 and 800 diode laser system is in the market is accepted better than 1064 or 694 Ruby laser system. But we don't know exactly about 1060 nanometer diode laser because it is really new in the market. And there are lots of articles about which wavelength is better. Usually, alexandrite or diode laser system is better. And I like this article. This article is published was published in 2009, and the results came from meta-analysis of previous report. And if we look at this article, diode shows the best results and alexandrite is okay, and ruby or neodymium laser system shows much less efficacy. And that is quite similar to my experience, because I have also long-burst neodymium laser and Nd:YAG laser systems, also several alexandrite lasers. I have Gentamax Pro and other laser systems. Proper prostration. If we check or consult the famous article written by Rox Anderson, Extended Theory of Selective Photothermolysis, they claimed that 100 or 200 milliseconds is effective also, but I tried 100 because with light shear systems we can use 100 milliseconds prostration and 400 milliseconds prostration, but I found that 30 to 70 milliseconds prostration shows better results. It just came from my personal experience. And 3 milliseconds might be okay if the hair is fine. So for example, female extremities and underarms. But if we want to treat forehead or bikini line or male face, for example, coarse hairs, then we need longer prostrations. So 30 milliseconds, 40 milliseconds is quite okay. And spot size, definitely, we can think that with larger spot size, we can deliver laser light deeper. So this article shows that if you increase spot size from 12 millimeter to 18 millimeter, they showed 20% improvement of hair reduction. And also, I presented the results. If we increase spot size 3 times, then we can get a 30% improvement of hair reduction with the same fluence and same prostration. And also, I published this in the journal recently. And this is very interesting presentation by famous Dr. Victor Ross, year 2014. If you increase spot size 4 times and measure the temperature rise in 3 millimeter below the skin surface, you can get same temperature rise with half of the fluence. So in other words, if we use 1 square centimeter, example is 1 square centimeter 10 joule equals 4 centimeter square 5 joule centimeter square. He presented this result, and I do believe this result. So large spot size is very important to get, but for HS handpiece that is okay because it is almost 6 times bigger than 12 by 12 and very large. So upper limit of fluence is 12 joule per square centimeter. So we can easily calculate that it can be doubled comparing to 12 by 12. So 12 means maybe 24 joule per square centimeter for 12 by 12 millimeter. But if we want to use 30 joule per square centimeter, we don't have any choice using HS handpiece. So I am using HS handpiece also, but if I want to use higher fluence, I have to go back to 12 by 12 millimeter square because we cannot make higher fluence for using HS handpiece. Proper epidermal cooling, if we check articles about epidermal cooling, everybody do agree with that contact cooling is best for hair removal. Even the developer of Cryogen spray cooling, DCD, Stuart Nelson, wrote an article that for laser hair removal, contact cooling is better than his development DCD. So you can find articles about that in journal. And also, I maintain my room temperature 20 degrees Celsius all year round to reduce skin surface temperature. That influences also very strongly to protect epidermis, to reduce a side effect. If you look at this article, cold and warm, and they use just a cold air system, but the temperature difference is quite large, 5 degrees Celsius, 21 with cold room temperature. In warm room temperature, only 26.1 skin surface temperature. So 5 degrees Celsius difference between warm room and cold room. The skin surface temperature is such different. So, and also, if you look at this article, the right red circle means 20 degrees Celsius surface and no side effect. And the left one, 24 degrees Celsius, and there was a crust after treatment. So even only 4 degrees Celsius difference makes huge difference. So it is published by Goldberg, year 2006. So I try to maintain my room temperature, treatment room temperature around 20 degrees Celsius all year round. Proper evaluation of permanent results. I always wait at least 6 months, sometimes 1 year after final treatment. The reason is why? If you look at carefully about the change of hair numbers in articles, usually after 6 months there is no change. We can find many articles about the results. All articles shows that hair number is stable after 6 months. And interestingly, if we look up permanent chemotherapy-induced alopecia, please check what is the definition of permanent chemotherapy-induced alopecia. The definition is 6 months no hair growth is the definition of permanent chemotherapy-induced alopecia. So the hair biology is the same, and 6 months is enough to evaluate permanent results. But for in hair removal clinic, 6 months is very, very long time to wait, actually. So if you treat hair removal, you will realize that waiting 6 months is really long time. And if you do not treat hair removal treatments, then 6 months looks might be very short. So this article shows that usually if the treatment is failed, then after 6 months or 7 months, hair grows back. And that's what I experience always. So, summary again for the best permanent hair removal results: no skipped area, high fluence as possible, biggest part size as possible, if the fluence is the same. Because it's quite difficult to get the same fluence if we enlarge the spot size, because with large spot size, the upper limit of fluence is low quite. So, the number 3, biggest spot size as possible means biggest spot size as possible with same fluence. That is important. And select proper wavelengths and perforations, regular treatment, and lower room temperature. Removing almost all hairs permanently with very low failure rate is possible. I suggest that that is possible at least for untanned Asians with black hairs. Then why is it so difficult to remove enough hairs permanently? Number one is the good machine is very pricey, like Shear Duet or like Shear Desire, and even Infinity might be much more expensive, I guess. And long-term treatment time, if you do not want to skip any area, it takes, in my clinic, it takes 1 hour for treating lower leg. I cannot shorten the treatment time any shorter. Lower leg, for 16 years, 1 hour treatment, I'm doing that. So long treatment time is another problem, and poor compliance of patients. Because hair removal is not so important for the patients, usually underarm and extremities of female patients. So the weather is good, they go outside instead of visiting my clinic. And if it is rainy, then do not visit my clinic also. So that is a problem. And because the cost became less and less, so that makes less motivation of physicians. But if we overcome these problems and follow the principles strictly, we can remove more hairs permanently. Last month, one textbook was published and I wrote a chapter, 28, about aesthetic laser hair removal for the Asian face. It was published in New York Theme Company. So if you are interested in laser hair removal of face and widening of forehead, please consult this book. I tried to make myself clear in this book. As a result, overall 90% of permanent hair reduction, 90% permanent hair reduction after 5 treatments is usually what I get. And final destination of my clinic is permanent or nothing. Thank you for your attention.